Hey everyone, it's Dr. Erica Person with Flex Audiology, and today we're going to talk about hearing aids, which hearing aids are best for tinnitus specifically. So not all hearing aids are created equal, especially when it comes to tinnitus relief. So if you're shopping for both hearing aids and tinnitus, here is what you really need to know. But first, if you could just take a second and hit that subscribe button or give me a thumbs up. Any of that helps increase the awareness around this topic. It also allows that you'll get any notifications of new videos that we put out regarding this topic. So what makes a hearing aid tinnitus friendly? It's really not just about amplifying the sound, it's about how the device supports the health of the brain. So there are some key features that I look for in those hearing aids. One of them is just simply a built-in tinnitus masker. Now, a lot of them have tinnitus maskers built in, but they are just not created equal. Some of them are pretty basic where they have just a white noise or maybe a brown or pink noise. I really like to have my devices have multiple sounds available. And really what's most important to me is to be able to customize that tone. Typically when you're getting tested for your tinnitus, you're getting really a pitch match and a loudness match, so we can really be able to hone in when we are shaping the sound therapy for those hearing aid devices. And then also what's critical for me is Bluetooth connectivity, which again is not so much of an issue anymore. Almost all of the hearing aids have Bluetooth connectivity, but what's important for that is that we don't want to rely on the hearing aid devices themselves. We really want to be able to make sure that you have access to other apps, other sounds, and instead of having to have something on your desk or a radio or something like that, you can have it streamed easily into your ears just through the use of the hearing aids. And then also we want to make sure that the devices themselves, if you have hearing loss, we want to be able to treat that loss. So it's unbelievably important that the devices themselves are highly effective, that they have the premium features that we need to reduce your listening fatigue. It's not about just bringing in the sound. It's not about just making sure you can hear speech well. It's about making sure that when you're in these tough environments, that you're relaxed. You're still not having to struggle as much to hear people, because the more your system is relaxed, the more likely your tinnitus will start to soften and reduce. So what are top hearing aid brands that support tinnitus relief? It just really depends on the clinic itself and really what the goal is. So when you find a tinnitus specific provider, they're going to have the devices that they automatically navigate to. And it's hard to really rank them depending on just in a vacuum all by themselves, right? So it kind of depends on what you're going to use for them. But there's really 5 main companies out there. And you've got your Phonak, your Oticon, your Widex, your Resound, and your Signia. And Signia is unique in the fact that it does have notch therapy as well as the customizable sound. And Widex is also very unique in that it's got what it's called its Zen therapy and fractal tones. But don't discount the other 3. Phonak has something called Tinnitus Balance. Oticon has its Tinnitus Sound Support. And Resound has its Relief app. So depending on the practitioner that you go to and depending on the type of treatment option and the type of sound therapy, that really truly dictates the brand that we're going to pick. It also will come down to, do you have hearing loss? I have a whole video about hearing loss and tinnitus, but depending on your hearing loss type and severity and where the tinnitus pitch is at, could dictate which brand manufacturer that we go with. And it's unbelievably important that this is personalized. So make sure you go to a practice that provides a variety of manufacturers who work with a variety of manufacturers, because if they only work with one, chances are you may not be getting the best option for you. The devices themselves should be programmed using best practices, of course. So that would be the use of real ear measurements. That would be the use of test box measurements. That would be testing you in the booth with the hearing aids, making sure that it improves your communication scores via questionnaires. Because tinnitus treatment is not a one-size-fits-all thing. I mean, it really comes down to the personality of the type of treatment option that we're going to choose for you. And a good provider, one that specifically has been tinnitus trained, they're going to look for a couple different things. If you haven't met Stella yet, this is Stella. She's our pathologist here at Flex Audiology, and she has just woken up from a nap. So getting back to a tinnitus trained audiologist, they're going to have you go through questionnaires. They're going to test your tinnitus, pitch, match. They're going to rule out other medical issues. They're going to rule out whether or not you have hyperacusis, whether you have misophonia, if you have a medical issue where you should be going and getting tested at your primary care doctor. They're going to have a variety of sound therapy options available. And then hopefully they are also looking at biomarker tracking. So that is fairly new in this space, but there's quite a few in the industry who firmly believe in that. And I'm definitely one of them, because here's what we know. There's a lot of things that cause tinnitus to get worse, and that can be stress, it can be anxiety, it can be poor sleeping hygiene. And so biomarkers really help identify kind of where your baseline is, and we want to be able to see progress over time of improvement in that area. If you're not familiar with what a biomarker is, you probably already have one. If you've used a Fitbit, if you've used an Apple Watch, if you've used, I think commercially, I'm thinking of the Aura Ring. We have our own here in our clinic that we use. And we're really looking at the person as a whole in order to move you from a period of the tinnitus not impacting your life greatly to where it's really a non-threatening signal in your life. And once it becomes non-threatening, it can move into habituation to where you hardly ever even notice it anymore. So generally speaking, if you have hearing loss, we're going to want to look at a device that can treat your hearing loss in addition to having a really robust sound therapy option in it. And again, from there, we're going to look at, we need the best practices for the hearing aid fitting. It's absolutely critical that we're using real ear measurements, because it's really impossible. It'd be very, very difficult. I guess not impossible. It'd be very, very difficult to set up a TRT protocol without using real ear measurements. You need to have somebody that knows how to do the counseling for those sound therapy settings in the hearing aids, and then also be able to do follow-ups to adjust the settings. There's nothing worse than getting a patient in my office who has been fit inappropriately, in addition to coming to me specifically for tinnitus therapy, because then I have to really backtrack and start from point A when we could have been starting from point C and D. And then, of course, we need to be able to track that over time. So the hearing aids are actually doing more than what you think they are. I mean, beyond just the sound therapy, patients will report just the reduced awareness of the tinnitus. They have better concentration. Because they don't have that listening fatigue, they have more energy, they're less anxious. Since their communication's improving, they have an overall better quality of life. And so really, this video is about which hearing aid is the best, but depending on your practitioner, that will, and the type of treatment options that you're going to go through, that will dictate the brand. So my takeaway is that don't get so locked up in the brand. There's really good ones out there, and make sure that you're with a trusted tinnitus trained audiologist in order to be able to complete your treatment. If you have any questions, drop them below. Obviously, you can call the office. We'll try to touch base with you, but tinnitus friendly hearing aids, they can be life-changing, but only if they're chosen properly and tuned properly. So until my next video, I hope you guys have a great day, and we'll talk to you soon.